And I guess my last question is another philosophical one for you in the multiple myeloma field, because I read some maybe opinion pieces about this word cure in multiple myeloma. And you mentioned, this is not a curable disease, but the opinion pieces I read is very provocative. And should we be redefining the word cure, particularly because of what you said, is that these patients are living decades on 10 plus lines of therapies. I mean, I guess, do you have any thoughts about that? And do you see in your practice that patients are passing away from something completely different than the multiple myeloma?
Absolutely. So ultimately, our goal is actually for that to be the case, right? I mean, we don't want our patients to die for any reason, but ultimately, we don't want the myeloma to be the thing that causes their problems later on. Um, so yes, we do, kind of we hope that patients pass away ultimately from other things. The word cure, I think, is it brings so much hope, and I think that we don't want to take that away. It's very hard to have those initial conversations where you're saying to a patient, this is not curable in most cases. We are starting to say, there are probably a subset of patients who have been off treatment, who are doing well, and really don't have a recurrence of the disease. It probably is true that in some patients, this is curable. I would say for right now, based on the treatment strategies we have, that is still a minority of patients. And I think that psychologically, I try to prepare patients for the eventuality that they may very well be on treatment for a very long time. And it's not to say that the disease will be active during that time. Actually, it very hopefully will not be active during that time. But because it is still such a small group of patients who can be off therapy and have disease responses that are that deep, I still hesitate to use that word as a promise for patients up front, right? And I think that's, it's just a little bit of sort of assessing the psychology, having a one-on-one conversation with a patient and really talking about both possibilities, but that, ultimately most patients need treatment, but the treatment is tolerable and can get them many years of good quality life.
Yeah, and I think that's fair to say. It can be very excellent quality of life with a lot of the multiple myeloma treatments in 2025. And I'm sure, the heterogeneity of outcomes of multiple myeloma very vast, and it's almost impossible to predict who would go on which trajectory from the first time you see that.
That's exactly it. We don't have perfect predictive tools. And if we did, of course, then we would say, hey, you might very well be cured by this. But we aren't there yet in terms of our ability to predict.
Right. Perfect. Okay, so I will close this panel discussion. Thank you so much, Dr. Cooper. Please stay on for the Q&A session at the very end.